whether they're going to be like EBT eligible, whether people are going to be able to use any sort of state or federal assistance benefits to pay for medical marijuana. Do you know the answer to that question?
So right now, our regulations don't prohibit that, but it's one of the things that we're actively taking a look at to ensure that we've addressed that, and whether that's use of ATMs in an RMD, we'll take a look at that, and what some of the other options are. But it's one of these, an area where, as you can imagine, there's a number of things that, as we've moved the process forward on medical marijuana, which was designed, based on overwhelming response from the Commonwealth that patients wanted access to this, we're going to have to do some follow-up on how it interacts across some of our other agencies.
Which way do you think it should go?
I would argue that the ATMs shouldn't be in the RMDs, and it's as a medicine, it should be used the same way that they're used now. I'm actually not sure if we can use a SNAP benefit for medicine at this point, so we'll have to take a look at that.
Give us some examples. What has that vetting process turned up in the past couple of weeks?
So I think it's, as you've seen in the press, there's been a number of issues where, an applicant cut and pasted a piece from an application into the wrong segment of the application, which made it look like they had support that they didn't. There's been questions about whether or not in another community, whether or not an individual actually knew what they were signing when they signed, a letter on the city's letterhead of what they were supporting.
Just to be clear, the first example you cited, that was the Boylston Street dispensary.
Correct.
The second example you cited was Herald.
That's correct.
Okay.
That's correct.
Just to make sure we're talking about the same thing.
So, those things are found as a part of the application process, and I think, as you know, we haven't issued any licenses yet. We've moved 20 people into provisional status so that we can do the verification phase. And the verification phase, will include, we have to approve their operational plan. We have to approve their siting and their zoning from the local municipalities. And most importantly, we have to, now take what they signed under pains of perjury and review, what information they had in there, what support did they have, did they have local support, do they have a lease in the location that they have. Once we get through that process, we'll be able to provide them a provisional certificate, which is what they need to then begin the process. Beyond that, we'll have to do all of the inspections. So a growing inspection, a grow-ready inspection, a processing inspection, a retail inspection, in order for them to get through the process. So I think we knew that a number of these things were going to happen, because if you think about it, we knew that there was 100 applicants. We could only give up to 35. So right off the top, 70% of the applicants were not going to be eligible. And given that there is significant revenues associated, that 20 that are in provisional status, on their applications, identified $83 million of new gross revenues for this business. There's going to be a lot of interest in us getting it right, and that's why we've got this process to do that.